Okay, so we're good to go.
Mhm.
All right, hey everyone. This is Adriana from the Foundation of IMG. Basically, today we're going to be talking about mental health resilience for healthcare professionals. This is a really important topic because mental health, even though we advocate that it is very important, oftentimes we kind of forget to take care of our own. So here we have Mr. Jake Mitchell with us, and he's been really great in supporting the foundation throughout the past year. He's been helping us with medics on site to be able to actually get everyone prepared for certain events that may happen on site at festivals and whatnot or on the streets. And it's definitely been a very useful tool for our IMG population or our IMG members. Jake, thanks for being with us.
Thank you for having me. This is exciting. Another thing too about the whole festival idea is I think as soon as COVID's over, there'll be a lot more cool opportunities to maybe do some shadowing and like really getting out there and reaching out to some of those festival organizers. So
Definitely, definitely. Jake, why don't you tell us a bit about your background so that everyone kind of get orientated with that? Yeah,
yep. So I guess it's best to start from the beginning or where I'm at now. It's kind of weird.
as you want.
Cool. So I started out as a paramedic at the old age of 19. No, but yeah, starting out very young, right out of high school. I knew I wanted to get into medicine, but I didn't have the attention span for med school. So paramedic was like this kind of, oh my God, ADHD, great brain for that. So I got into that and really enjoyed it, like learning about medicine and patient care theory and everything. Like it really made me wish I had the brain to be a doctor. But knowing I could work alongside doctors and other healthcare workers was exciting. But when I was a student, part of getting to know yourself, I struggled a lot because of my busier brain. And it caused me quite a bit of hardship early in the career. So my first couple years as a paramedic, I wasn't very confident in myself. Like I was confident in my skills and I knew I could get the job done, but deep down there was something inside myself. But got through nice, healthy 4 years of that, and around the fourth year, I really started to struggle with depression and some post-traumatic stress symptoms. That I started to identify with some support, and decided to take a step back. And it was really hard for me, and I knew I was passionate about addictions and mental health. So I thought, okay, let's take this break here before I completely lose my coping. I'll learn something new and see what I can do. And then right then, something called safe injection sites started. So you may have heard of what a safe injection or safe consumption site is. It's basically a facility or just a tent or some type of an area that's sanctioned for people to bring illicit substances like heroin, crystal meth, fentanyl, what have you, and use them in a safe space with healthcare professionals present to not only keep them healthy and alive, but to try and help them figure out what it is that's making them use the substance and what they need and supports to be able to get control of their life again. So I was able to bring the paramedic background with my passion with mental health and really grow in that field. And that's what I've been doing the last few years. And I've just recently started now as a case manager with Reconnect Community Health Services, where I'm getting to do a lot more intensive work with clients with really severe mental health problems.
Awesome. And you brought up like a couple of like really great topics.
Mm.
Number one, dealing with your own mental health concerns while being a student is huge. And I'm pretty sure like a lot of our members can identify with them, whether you're currently a student or you're an alumni or you're going into residency. Congratulations to everyone who matched this year. You do have to embark on a lot of mental health challenges, and I feel like even especially in medicine too, and maybe you can also speak on this on with regards to being a paramedic, but it's like being consistently bombarded with mental health challenges. And what's incredible and something that we learn in medicine is that the human brain is incredible on its own, but it does everything it can to protect you. So these coping mechanisms, and also you talking about like the injection sites, those are actually very popular in North America for those who are watching this who are not from North America. It, they can be tools of coping and really breaking it down and trying to ask, well, what are your triggers, what are things that are bringing you to that point, is that really the healthiest thing you could do for yourself? really is important. And, taking a break, taking a step back, being able to take care of ourselves and make sure that we actually do attend to those and ask those questions, it just benefits us so much more in the future without constantly bombarding ourselves and making the load even bigger than what it was when we first started with trying to cope in some sort of way.
We all have our capacity, right? We all have our limitations. We're human beings. And the problem with going into medicine is that there's this kind of symbolic cape you bring with you into that field that a lot of other people really hold up. Like there's nothing more powerful than when you're at the scene of an accident and an off-duty physician shows up and goes, "I'm a doctor," and everyone just goes, "Oh, oh, we're saved." And the doctor's like, "Oh, like, you hold on." But it really goes to show that, yeah, like that pressure we not only put on ourselves, but the public does, our standards do, and the field does, right? And we don't want to let people down.
And also our families. And
Our
I'm pretty sure a
families.
lot of people who are watching this are probably thinking, what's going on at home. You have pressures from your parents, and even family members or family friends who just want to see you do great and maybe don't understand the path. Yeah, an aspect of that is also like helping to educate them, but sometimes, even especially if you're going through this path over a longer period of time, it can be frustrating, and it itself can be a trigger.
Yeah, that's the other thing too, is I want people to understand from what you've said there, like to find in themselves, the factors in them that are biological, that are protective factors and risk factors. Maybe, they work out or something, they got some type of routines or something that they can really know, or good sleeping patterns. Geez, those are great. I wish I could sleep great all the time.
What is it?
Yeah, maybe great genetics. Those are protective factors, but then biological risk factors too, we don't control all the time. And there's certain things we have predisposed to, right? And we won't get into all that right now, but then the psychological part, there's different psychological risks and protective factors we all carry as well, and we're all different in that. And then the social as well. Are there any social supports that I have that maybe you don't have, or vice versa? And all those things, biopsychosocial plus, you might hear a lot now in the healthcare model, not just mental health anymore. Good family doctors now take that holistic approach, and holistic meaning biopsychosocial plus, right? Not the
Definitely.
stigmatized way of some people think holistic means, but yeah. So biopsychosocial plus in yourself will allow you to know your limitations and give yourself credit as a human being.
Definitely. I think that in and of itself, breaking down, if everyone did take some time to break down those different aspects for them, and just kind of, and this may be something that even our peers can use for themselves when they're at home, really breaking down those different sections and saying, okay, well, what are some of my mechanisms that take care of that? How does it serve me? Is it a positive one? Is it a negative one? And I guess what I'm going to ask you, Jake, is, because this topic's on mental health resilience, what does mental health resilience mean to you?
Perfect. I actually think that's a really good question, because I have a question I ask all the time in the workshops I do. And it's when I throw up generally to everybody, and I'm always surprised by the answers. I ask that exact question. I give a multiple choice. And my multiple choice basically says, is it, sorry, hold on a second, because I have it right here. A, the ability to suck it up when times get tough. B, having the resources to cope and face daily stressors. Or C, not being affected by stress. So a lot of us think that it's C basically, or A, like, oh, I have a friend who can just suck it up when times get tough. They're not affected by anything. That actually doesn't mean resilient. It doesn't. And we think it does. What resiliency really is, you have to look at the definition of what mental well being is. It's your ability to enjoy life, face the challenges that are, common around you, and thrive, right? To find some meaning. So that's why resiliency, it's not about sucking it up. It's finding the coping mechanisms that you need, that you specifically need to be able to reach your best potential, and then know where your sort of, I don't want to use the word weaknesses, but risk factors lie, so that you can make sure that they aren't pitfalls for you in your life. So the more that you do enhance sort of those learning objectives, or sort of growing opportunities, the easier it is to face those challenges. And then you'll become resilient. And that's true resiliency, because it's okay to not be emotionally composed and still be resilient. Like if you just found out your family member just passed away, Absolutely. It's okay to break down and cry. It's not like it doesn't mean you're unresilient. You're going to be more resilient, most likely, than the family members sucking it up and trying to be strong for everybody. So I think you have to be honest. That's also resiliency. So knowing your limitations, knowing where you need to improve, and that's self identified a lot of the time, and then honesty. Those are the ways that we can be resilient. And don't be afraid to ask for help, is the fourth one.
Fourth one's a big one. I think that that's a huge challenge for us, and I think that one of the things is, how much energy is it going to take for me to ask help and go through the ringer and have to deal with it and have to like express versus just sucking it up and moving forward. But no, I love your multiple choices, and honestly, I would say I was going to say it was B anyways, because at least from my own personal experiences, I've learned that one, we're not perfect. Things are not going to go as planned. There are going to be hiccups along the road, but it's like, when you go through, when you're driving on the streets of Toronto with all the potholes, eventually your tire gets dinged one too many times and may pop. But what do? You don't just keep on driving it all the way. You got to pull over somewhere, change a tire, and move forward. And that act of pulling over, changing the tire, and having a spare there is a type of method or coping, or that's how you kind of deflect off of what's going on and making it better so you can continue on with what you're doing. It might take a bit of time to pull over to the side and actually change that tire, and yeah, you might sweat and it wasn't something that you signed up for that day, and it could be so frustrating, the process through it. But you won't have issues with now the thing that's holding the tire being offline because of you driving in this like lopsided way. You know what I mean? Like it affects the whole car afterwards. And I think, like, for me, being able to, you have to know your limits as well, because sometimes, you can hold back and then come back to it later, but make sure you go back to it later, because if you don't attend to your mental health when you need to, or when the situations call for you to, it will affect you completely, and it will manifest into this monster later on. So get to it when you can and soon, even if you think it's going to take some time. It's noted time. Your colleagues will be fine if you do, and communicate with people around you. And that bit of asking for help is also saying to a colleague, hey, I'm dealing with a lot and I'm going to need some support, for example, at work. So you got to take on a little bit more load for me right now today, because this is what's going on.
Yeah. And there's no shame in that. We just put the shame there on each other. I think we need to make that more of well, I mean, look, it's the nature of the field, right? Like we pretend, and I think that's what you said about coping. Like we were talking about this just before we started recording, that like we learn coping like through most of our or, well, all of our early life, right? Up until our 20s. And like part of that survival, if not all of it's about survival, right? And the idea that when we're in any type of medicine, first response, family medicine, emergency, whatever, um, we, sorry, I just lost for a moment there, but we, hmm, sorry, I just lost it. That was weird.
No worries, it's okay.
It's up here somewhere swimming around in the air. It'll land back in here.
Pop back in. But with respect to us having those coping mechanisms early on, I feel like a lot of times we want the instant gratification ones just because of the time factor, which also means that a lot of the ones that give us instant gratification happen to also be the not so positive ones. The ones that after they are done, they leave us in negative feelings. And I remember I was talking to some youths, so youths being within teenage years and early 20s. Um, about, what's a good coping mechanism. And I told them, like, a good coping mechanism, a positive coping mechanism, and what is one that does not leave you lower than what you started with. It maybe it doesn't improve so much. It's not supposed to be like, a magic pill that makes you this like new person, even though pills can be coping mechanisms for some people. But but it's something that does not make you dip lower so that you end up becoming dependent on it. And that can be in many forms. It doesn't necessarily need to be drugs. It can also be even depending on another person. And to me, like, a part of mental resilience is also being resilient by yourself, for yourself, and not saying that you have to do everything by yourself, but knowing that you're not crutching anywhere. You're building. for you. And like an army becomes stronger through training, the same way that you would become stronger with your positive coping mechanisms.
That's exactly hitting the nail on the head there too. And it did remind me it ties in exactly what I was trying to say earlier. So like the survival and all that, we lose sight of what you just said because we're
Mhm.
trying to survive. And I think people forget that when we are able to actually stop ourselves and assess ourselves, and early on, it looks like we're really struggling to keep it afloat. Later in life, earlier than would have been before, you're going to be that person who is more calm and solid through more situations. It's the practice. And that's something I learned now that I'm 29. When I started in the field, I was 19. So 10 years have passed and my brain's done a lot of maturing. And there was a whole lot of denial that we go through, right? And that's another part of it. And even people having heart attacks,
Oh
they
yeah.
deny they're dying. Even when the paramedics are like, we're gonna drive really fast and just keep breathing. The person's like, I'll be back by dinner. It's like, well, so it's and there's a classic story of a dispatcher who he's a 911 dispatcher for critical care. He knows better. He is having crushing chest pain, dizziness, weakness in both arms, and he's driving to work. He can't make himself pull over, kind of what you were saying earlier. You think that human beings should be able to get it together with their mental health. We could be dying and we still can't take that control to be honest and know our limitations and ask for help. So common. And that's why family members are usually the ones that call ambulances for people, not the
Yeah.
person themselves. So it's same with our mental health, right?
So one of the comments you made was that he knows better. We know
Ah.
better as well. As healthcare professionals, we know better. We know that it's important to ask for help. We know that mental health, um, positive mental health routines or having therapy is beneficial. We know all those things. And what is the problem with it? What's the crux of that? And I mean, this is from my own opinion, but I know that there's a stigma that we all talk about. If you can talk about a stigma being there when you're a student, well, you probably believe there's a stigma there when you're practicing too. And that kind of lives on. So one thing is the stigma, not wanting to be a part of the stigma, like, oh, I can't take care of other people because I'm not taking care of myself. I thought that too, even like when I started medical school. I used to say, oh, I can't be an obs guy. I'm not an obstetrician gynecologist at the moment, but I'm just saying, like, it was something that I said, oh, well, that's especially I'm definitely not going to go into because I'm trying to learn about my own body, let alone help somebody else.
That's fair. Yep. We
But
all
meanwhile,
get that.
like in my clerkship, I'm falling in love with it after like delivering a baby. I was like, whoa, mind blown that actually this is something that would
Let's
be.
pause on that because experiences like that, right?
Mm,
Even major experiences, and we don't always choose when they happen to us, but
yeah,
being aware to be open to those experiences. And then when they happen, looking and reassessing, because that did seem to shift some stuff in you, right?
it was a heavy shift. But the reason why I rejected it was because how could I be an expert or someone who can take care of somebody else when I'm still trying to figure out me? I think that we also kind of employ that when it comes down to being sick or being, not at our A game mentally with respect to certain things. It's kind of like bringing that whole question again. Well, if I can't handle it, or if I can't suck it up and move on, or if I can not be affected by it, well, something's wrong with me, and I can't do my job properly, and I'm not that ideal person. Well, shoot, man, we're not everyone is supposed to be Superman on the ward. That's why we all have our own specialty. Otherwise, one person would do everyone's job, and that's not doable. The same way it's not doable to put the world on your shoulders and inherit that chaos. And I think that a lot of our colleagues think that it's like what we signed up to do, but it's like, no, we signed up to do this trade, medicine, whatever aspect of medicine whoever's watching is identifying with, whether it's as a physician or as a nurse, as PA, as paramedic. We don't sign up for this to inherit chaos. We sign up for it because we are good at something that benefits the end result. That can be anything. That's literally so broad, and it can also be so small too.
That's part actually is really beautiful to say, the chaos wording too. We want to be able to enter chaos, but not become the chaos. And I wonder too, and I think you can maybe even add to this, how much of the we know already address the media, but we don't have enough mentors and people that we look up to that openly have struggled or that will admit to doing things. Because look, I'll tell you something. We all have done things in our lives that we don't want to share with other people. And that doesn't mean that they're bad, atrocious things, but we all have different moral perspectives too, right?
Mm,
Like there are some people who cheated on a high school test and they'll never forgive themselves.
yeah.
Some people, they'll steal from a loved one tons of money and not think twice, right? So we're all different that way, but we've all been challenged. And that's where it's really difficult. So going into chaos, we don't know what we're bringing with us. And when I was a student, part of what bothered me a lot, this is interesting. My preceptor, he couldn't articulate it, but he knew exactly what I was going to struggle with in my career. But he
Mm,
couldn't voice it to me, right? So it came out in a lot of frustration and strife between us, right? And I remember one point he sat me down in an emergency room after a call and he's like, Jake, like, I just don't know anyone who does this job, well under 25. Like you should have more life experience. And like he knew what he meant, but he couldn't say it the right way to click with me. And I'm like, oh, but like, how do you get life experience? Doing stuff, right?
yeah.
But what he meant was coping with myself and taking failure. Because what I did was every time he told me, oh man, why'd you do that? That wasn't good. I just took it like him saying, "You fucking idiot." Oh, sorry to swear here, but sorry, you idiot. Like you don't know anything, and you're like it. I took it like that, but he
Yeah.
really was just kind of going, "Hey, man, like the standards are this. You didn't meet the standard. Let you know." And it spiraled in me because I wasn't able to pause and go like, "Oh, okay, so I'm gonna learn from that, and if not, you'll tell me." It was like, I gotta be perfect. I gotta be perfect, and if I mess up, oh my god, I'm gonna let him down. I'm gonna fail. No, he wanted me to be honest. That's what he really wanted. And he wanted me to grow and take criticism.
So definitely the fear of failure or the fear of going through a struggle through the path, I think can resonate with so many of our members. And you're right, people, mentors, there aren't enough mentors that we, I guess, there are enough mentors, but not enough mentors that we recognize that actually are our mentors who are trying to guide us and protect us from certain things that are happening. So we have to be open to that, and really take a look around you guys. They are right there with you. Um, but a lot of our examples or people who look up to aren't necessarily the ones who openly discuss when they have failed, whether it's a test or it's a board exam. Like, guys, this is something that is so common. We don't, and right now, like the topical thing is matching, right? The American match just finished and the Canadian match is now in the second iteration at this point.
Okay.
And the match basically is where someone who's done their medical training moves on to attain a residency spot to further learn how to be someone in whatever specialty that they want to train in. Okay, it's more learning. But like people aren't necessarily going to openly say the number of years they had to go through the match. They're not going to say the number of times they had to go and redo an attempt. You know what I mean? And it's their right. They don't have to share all that information. They don't have to disclose that. But it's everyone who is a physician who's working right now, they're not all perfect. I'm not trying to bring them down or anything like that, but it's just that they've had to go through their own struggles to get there. They've had to go through their own failures to get there. And sometimes failures aren't even just in the aspect of a test, because I feel like that's a really big fear that a lot of like our juniors have, people who are in medical school currently or recent graduates or just starting out the residency. Exam failure, because they're so heavy and they're so exhausting, that happens to be the biggest fear right now. But there are also fears of failure in relationships that our colleagues also have to go through. Feels of failure in parenting as well. How much time does your specialty take from you? Like it's something that I've had to also like talk to myself about. I know that if I were to go into a surgical specialty, it will take a lot of time. I will do my best to balance everything. But and this is something that a surgeon actually told me once. I asked them, how do you balance being such a committed, high responsibility surgeon in an academic facility and also a mother? And I think especially women in the field, you kind of there's a lot of expectation as well to be a great mom and also a great career woman. It's very hard. Um, but her response to me was, "You can't be perfect at everything.
You can't.
Something's got
Yeah.
to give."
Yeah.
So same thing with regards to individuals who are currently trying to find mental health resilience right now. Understand that the things that you're burdened by, the things that you put into your bubble map of what's going on in your life, you can't be perfect at everything. So don't expect yourself to be a 10 out of 10 in everything either.
I have
Like
an
I
exercise for
sucked
that
at
too.
soccer, but I joined soccer so I could have some like physical activity in first year. I sucked at it. I was not 10 out of 10. I was maybe a 1 out of 10 because I could run to the other side of the field. I'm aware. I don't take it to heart.
That's the thing, but this is cool. But that kind of honesty and like understanding limitations and growing because of it, there's a good exercise we can use for that. And I think we should always. This is a great thing I do whenever I'm feeling out of sorts, especially with career transitions or preparing for big things like decisions in life. Draw out or make a list, or however you, if you're a visual person, make a picture, um, and code it, either color coded or some way for you of things you can control that
Mm,
you know as a human being you can control, and or at least someone can help you control whatever, and then things that you know are out of your control and you maybe have to practice some radical acceptance about, and separating those make it much easier to feel like you can cope and maybe one day, if not now, meet those challenges. And I think that's our way, and that's how I do it with myself. I go, well, bio, psycho, social, we can actually do some things about those, but there are also parts that we can't do. So COVID right now, right, takes away a lot of social stuff we can't control. I mean, there's some things we can do with it, like virtual stuff, but it's hard. Psychologically, well, some of us have more resources than others, right? A lot of us have different, like, oh, I play guitar. Okay, well, how many people can just pick up an instrument and learn that? Some people read. I don't have a good attention span for reading, right? So we're all different. And I think knowing what you can control biologically, psychologically, socially, and then spiritually.
mm,
Spiritually is whatever it means to you. It could be your emotions, it could be your higher power, it could be whatever it is you subscribe to that way. Those are the realms that you should separate and maybe make four squares, and then draw out like 1 to 3 activities that you can do biologically to improve yourself, that's controlled. And like you said earlier, use that guideline of, is it something that makes you better or is it something that makes you weaker after. 1 to 3 things in each of those four realms that make you stronger, make you feel stronger. And if you can practice those on a daily, weekly basis, whatever you can manage, right? And make them manageable tasks that you enjoy, there you go. You're going to see yourself at least have a template going forward. And then watch, right? Watch for the things that work, the things that don't, and be easy on yourself. Oh, I can't get through a page reading. Okay, fine. Read half a page.
yeah.
And you do it that way.
Yeah, definitely being honest with your limitations is important. Jake, what I want to ask you is, when do you think is the time that, because again, a big issue I feel from between our colleagues is not being able to recognize when we need that step back to be able to like better build ourselves, have mental health resilience. A big part of it is also recognizing when to stop. When do you think is the time that you need to step back and stop? Like, how do you, what are the flags essentially?
Great. One thing I like to open this up with really is there's five basically. Nah, let's switch it to six to be careful here. 6 areas of our well-being that we want to be aware of as we're talking about this, right? Physical well-being, psychological, social, and emotional. We talked about those, but then there's legal and financial, right?
Mm,
So there's these 6 areas of our well-being that all human beings, no matter where we are, have some level of that we have to take care of. So being aware of those, as long as you're able to cope with all those and you feel that all those areas have a stable well-being for you, then chances are you're coping fairly well with whatever you're going through. Even if you are stressed down to the core, you're feeling uneasy. But here's some signs and symptoms that you can look at that maybe you're slipping towards not being able to manage these areas of well-being before it gets too late. And I will share something. I think on this, I'd like to send you some things that you could put up on the website. Maybe there's some area of resiliency tools that folks can reference. Um, One great one that I like is this thing called a window of tolerance, right? And you already mentioned part of it when you talked about the swinging and the pendulum of like you do something, does it make you feel great, but then you feel worse after? Well, we all kind of swing on this pendulum of our continuum, right? It's our mental health continuum. It's not just good or bad. Eustress or optimal arousal, you may have heard this term. That's when you feel, wow, cognitive flow. You're motivated. You can accept anything that's happening around you. You feel like you can face the challenges, increase potential, and your mood has normal fluctuations, and your coping behaviors are your normal ones. They're your baseline, and you feel you're in control to a degree, or you at least know what you're in control of. Distress. Now, maybe things that you're doing in your life, you're kind of pushing yourself a bit and you become distressed. That's more like a hyper arousal. Now, this is things that we can enter moment to moment. You know, you get into an argument with someone you care about, you know, you almost get in a car accident on the road, or someone cuts you off or something, and you enter a bit of distress. You're going to get some fear, maybe some anxiety, bit of confusion as the blood flows away from the prefrontal cortex, that hopelessness, a bit of sadness, maybe in some folks, depending on the situation, increased need for like substance use and unhealthier coping mechanisms, maybe, and an irritability and mood swings outside of your normal mood swings. That's now a sign that you're being pushed to your limit. It doesn't mean you're overwhelmed yet, but you maybe need to take a step back, reach out to a friend, say, hey, look, I'm feeling a little off, maybe talk to me about this and maybe see what I'm missing. And then go back to that board of those four things and go, is there anything here I'm slacking on right now, or things that I care to do that I'm not able to do? And try to take care of yourself. But if you stick in distress too long and you don't move back to eustress and optimal arousal, calm down and relax, and you're stuck there, like post-traumatic stress and anxiety disorders can often do, you then can hit a red line of dysfunction. And that's when the nervous system, the mind, body, and the brain, the mind, body, and brain, basically, because, mind and brain can be separated, all of them are crashing now. Distress, they were just being pushed to the limits, and dysfunction, they're crashing. You're in depression, burnout, that fatigue, compassion fatigue, poor performance, emotional crisis are shutting down. So really poor coping mechanisms here, and you're unable to maintain your most basic needs sometimes, whether it's showering, studying, taking care of yourself, and then impulsive behaviors, increased unhealthy coping. So being aware of these three areas, they expand, in different categories, but optimal, hyperarousal, and hypoarousal. We want to stay in optimal arousal best we can, and we take care of that how we want to or how we feel we can. But if we hit distress, we need to take care of ourselves before we become dysfunctional.
Very cool. I like the way you broke that down for sure. And you've basically like described dysfunction, or the point at which people even feel dysfunctional when they are dealing with anxiety and depression, like crippling anxiety and depression. It does feel like you can't do anything, that you're not contributing. And even if you do get into dysfunction, it's okay. But know that it is a crucial point to seek out help and be willing and ready to accept help as well.
Because dysfunction, remember there, and I like how you're saying this, where I can add to that is dysfunction's not can't function. And that's the one thing we want to remember. Admitting that you're in a dysfunction state does not mean, oh my God, you're failing. It means, whoa, I've just been pushed. I've been through a lot. That's what you should change the wording to in your self-talk. That's another part we can mention here. Like, it's not, oh my God, I can't do this. It's, wow, I'm overwhelmed. That's very different. Your brain does absolutely respond to self-talk. There's tons of research with that, and you can see it just day to day. Positive self-talk. It's not I can't, or oh, I'm messed up, or I'm not able to do this. It's, oh, okay, right now I'm overwhelmed and I need some time to myself to love myself.
Definitely. Definitely. And just as a comment to everybody and colleagues who feel like, that topic of or that aspect of, taking time for yourself, again, you may have goals that you want to achieve in a certain amount of time, but be generous to yourself. Take that time off. It's not going anywhere. And just in terms of like everyone's path and what they're doing, everyone's timeline is different. There's an ideal timeline, and then there's an ideal timeline that was told to you by people who had unideal actual timelines that they've followed. Why? Because things happen. Life happens. We sometimes get to the point of dysfunction and need it. And you know what? That lengthens things. No one's blaming you. Will someone ask you about it? Yeah. And you know what? Doing the work to understand yourself during that time you're better able to answer that question. And that shouldn't also be a question that you fear that someone asks you, let's say for an interview. And I do feel like our community does have that looming fear of, oh, what if they ask me about, for example, gap years? Okay, you're not the first one to maybe have a gap year if you have a gap year, if that's one of the things that you're dealing with. But what happened during that time? What did you do for yourself? Maybe what did you develop for someone else? What else was going on in life? Nobody can say, you know what, you just weren't robotic enough. That's not medicine. Medicine is a very human practice, and we do it because we're dealing with patients or taking care of patients in some form or another. It's okay to be human too. So,
Yeah.
Jake, with respect to like all this, and talking about, recognizing when we're getting to the edge, how can we, I guess, come like bring ourselves back up? I mean, other than what we've already talked about in terms of, asking for help and actually stopping and taking care of ourselves and learning about ourselves, what are some tools that maybe you can recommend to our colleagues?
Y'all may have heard the term boundaries before. And we always think about that with other. Aha, there you go. See, a bit of a problem, right? Well, the word boundaries doesn't only apply to others, applies to yourself. Applies to yourself. And I know we already touched on asking for help, but being open to accountability by people you've appointed to that. Have people in your life, like friends, family members that you trust, partners, that you could say, look, when I'm doing this, can you just let me know that I don't want to be doing that? Well, I can elaborate a little bit. For example, I come home sometimes when I'm exhausted, and what I used to do was I just lie down on the bed or something and just try a nap, but then it interrupted my sleep a bit.
Mm,
And this is back when I was staying with my parents, and I was like, yo, can you just like say hi to me when I come in and just stop me from going up to my room right away, and they'll jog me a bit. And that's what they do. And of course, there's times where I have to get a little angry, like, oh, I just want to, but I'm like, no, I've asked them this. They're holding me accountable. I've
mm,
said I want this to be my thing. And I do this with my clients right now, who have like really severe schizophrenia and stuff. It's not just for like this works for everybody. It's starting at that. Like, do you know when you need the help? And will you listen to me when and trust me that I'm not trying to control you? I'm just offering you my observations, and we're going to work together. So let other people know your goals. Let them also know your limitations, and have like a code word for like, look, I just need today a break. And they'll go, oh, good. Then self-care, no
mm,
pressure. And I do have a colleague that I work with at one of the safe injection sites where we have picked up on each other's physical symptoms of not being okay mentally, to the point where we can just look at each other and go, hey, are you all right now? And we already know the answer is no. And it's just to open that up for that person to go, oh my gosh, should I take a break? It's like, do you want to go for a smoke, or I'm going to go for coffee, whatever? And they'll go, okay. And they'll go for a smoke, and I'll cover their area. And that's part of that. And because we've done that, it's not so scary to then say that one day, look, I'm not okay. Can you step in? Because we've opened that up. So accountability is huge. Hold yourself and have others that you trust who can empathetically and compassionately hold you accountable, um, with respects to your resources. And also, I think what you asked, part of that question was like, how do we back up a bit, right?
mm.
Yeah. So
Back up and come back up and from it.
safety plan. So you may have heard about this with suicide, with discharge from a floor or something, from a unit. We have to come up with a care plan or a safety plan, right? Well, same thing for yourself. Have a plan for when you know you're hitting your wit's end, or you're hitting that edge and you need to back up. One thing that I think is really cool about, and this is also true with doctors, but I recognized it a lot with paramedics that were senior. You can't save everyone's life, right? I think that's just a general thing we can mention.
Yeah.
People die, like, we're human. So eventually we all die. And there's times where someone can have a severe illness or injury that's even acute, that's not age related, that you can't fix, and they're going to succumb to that. One thing that I found made my senior partners more confident was not thinking they can save everyone, but knowing what they could do,
Mm,
knowing what's in your toolkit, knowing what's in here, what's in my nervous system, and what can I use around me. And sometimes the answer is, I just need to stop. There's nothing else I can do. take a breather. It might be a couple days, right? So like sick time is so hard when you're a student because I don't think you get sick days or anything like that. Really, it's hard to
No,
make up.
no understanding from the board exam individuals to say, oh yeah, sure, do it. But I guess
Ideal world, yeah.
yeah, that's also like why people need to be like really honestly, guys, be generous with your timeline. It's okay, especially if you know that you're someone who has, and you said it before with regards to like your own tendencies or your own like things that you may anticipate that you may have inherited. You know what I mean? Like be generous with it, especially because you know, like nobody knows you better than you. You've lived with yourself your whole life, so you know your tendencies. One of the things that you've also mentioned with regards to accountability or holding other people accountable, like for when you're getting to a certain point, I feel like it's also really hard right now too, like in the pandemic, not seeing other people. So you don't have those, again, social supports who can keep you accountable and can see you. But also when we're studying by ourselves in a room. You know, we're not there with someone who can see us like slouching and recognizing, okay, this is when they're teetering off. You know what I mean? So, you know, the next follow up from that is, you know, how can you be good to your colleagues to make sure that you recognize them and actually can be accountable for them, and especially in this time, send a message to a friend, check in on them, give them a call randomly out of the blue, not to ask them for an answer for a question, but to literally ask them how they're doing.
You know what, a great thing for that too, because I think the asking generally is great. And you know, if your friends aren't like open to just those, or you want something more, there's some awesome programs out there like that you can engage with people socially distanced, very easy. There's things that you can watch movies together streaming online with like camera and chat. There's Jackbox TV, which is actually a really fun, I don't know if you've tried that,
I haven't
but
tried that,
oh
no.
my god. So everyone who's listening, if you ever are like, I need to spend time with my family and friends virtually, but I don't know what to do, I don't want to stare at them, Jackbox TV is this fun game we did at a work party where everyone gets on their phone and they play this like quiz game with all these fun little engaging games, and everyone's on their phone answering these questions, and it's really fun. And you're laughing, but at the same point, you're kind of checking in with each other, but it's less formal, right? So I think that's good. Another one's like a house, it's called House Party. I've used that where
I've heard that one
it's
before,
like
yeah.
FaceTime but has games on it. Like there's ways to check in with people. Like I love that, just a quick text. I do that with some of my coworkers. But if they're not like, I don't know, you want to make it more fun, then make it fun. Be creative. There's so many ways to check in with each other.
Yeah, you don't necessarily need to have it blatantly. You don't have to necessarily ask them, "Hey, how's studying?" Again, could be a potential trigger for that person. You
Ah,
can easily just say, "Hey, like I saw this today and I thought of you," and it happens to be like you know, some meme or whatever. Like you can enjoy those things. Maybe give them a smile, maybe give them a laugh. And one professor once said, well, he was actually he wasn't a professor. He was a visiting academic, but he was actually a CEO of a hospital. And one of the questions that he asked everyone in this like small room, this little get together that we had, he said, "Have you smiled in the past week, or have you laughed, or something like that?" And really, if you haven't had a laugh or something that didn't make you feel good in the past week at all, you really got, and this is what he said, you really have to reassess what you're doing.
hmm.
You know, and I mean, we've talked about this before outside of like this conversation, but you only have one life. Live it to the fullest, yes, but that's why being generous with your timelines, generous with how you talk to yourself, like your self-talk language, and how bad you're trying to put yourself down. You're only here for one life, man, and you got your whole life to learn. Literally, guys, medicine is the study of learning forever. So so like do not be so hard on yourself.
And that's another part. You might transition to different things because of that growth. You might start out like, oh, I'm going to be the best, urologist out there. And then like you find out like you really, really, really love carpentry. No, I'm just kidding. What's it called? Ortho. That's my little joke. If you ever watched an ortho surgery. um, but yes. So I think one thing I'm starting to learn, I can really add to this, is I started out the field thinking, oh, great, I'm going to retire the best paramedic supervisor there ever was with 40 years experience because I'm the only one who won't burn out in 5 years, all that stuff. And then realizing, crap, I really am more effective in mental health. And it's not that I wasn't effective with all those other calls, but like where I really felt I was in that optimal arousal zone at work all the time was responding to suicidal people, responding to overdoses, responding to persons in psychosis and crisis. Heart attacks, I'd leave those calls a little drained. Like, whoa, there's so much to do. And with mental health, arguably there's a little more to do because you have to assess more things you can't see. But it was just more enriching to me. Whereas my colleagues, Jake, you can have all the psych calls. I don't want to deal with mental health stuff. I'm like, well, you haven't dealt with your own, it sounds like. But like, there's this whole thing. I remember a guy said it specifically. He's like, I can't handle people who talk to themselves. I'm like, basically you're talking to yourself the rest of the shift. So that's it. Finding you grow and you find what you're good in. And that's why that fourth year, I just realized I was like, I'd rather just be doing the mental health and crisis stuff and that high intensity stuff more regularly than these like, oh, how long has this infection been going on? And okay, start an IV. Like that stuff to me, it started to get really hard because I didn't see it giving me the meaning. So find out and allow yourself to grow, like you said, and take the steps back. Also remember, it takes longer than you think. Trauma, for example, if you enter, if you have a trauma response from a very either one situation that's overwhelming or chronic situations, you sometimes need months to years to heal. And that's the really unfortunate secret to healing PTSD is some or post-traumatic stress is somebody needs to take sometimes months or years to have responsibilities on them to heal.
Yeah.
No society allows that. None, except for maybe ones from, back in the day when we were more connected to our human selves, right? Like back in tribal times. There's a book called Tribe by Sebastian Younger, I believe, and he was a former military. I think he's a Navy SEAL, but more healthcare workers than ever read that book because
Mm.
that's what we get out of it. Do we feel like we're in a family here? And that's another thing I think we can tie into in this is not only do we know our own selves and our limitations and our self-care and our safety plans for when we're, hitting difficult waters, but our family, do we feel accepted? I will not lie to you. When I was a paramedic, it's very hard to feel part of a team because every paramedic's different and many of them after 5-10 years are absolutely broken and it's hard for them to connect with you that way when you're a new paramedic who's excited still and all that stuff. And it was hard to feel part of the team full, even when I was accepted and I had gained the experience and trust of my peers. Like I always felt like I wasn't fitting in. But with the mental health field now, I'm part of this team where we talk about cases together, we engage. One guy's like, oh, we should jam, play guitar together one day. I'm like, wow, okay. So now I'm feeling it. Now I feel I can handle way more than if I was working with someone who didn't give a shoot about me. I don't want to swear because I don't know. I want to be very professional here. I
Yeah.
want all of you to be mindful too that with my background of where I come from, many paramedics have the mouth that's hard to keep the zipper on. But
Okay.
anyway, so I hope that
It's
helps.
meant to be informal anyways, and honestly, like even with respect to like how we talk to ourselves, or even in closed circles with our own friends too, we all know that we let it out. We let a lot of things show, versus what we try to be in the professional environment. The aspect of being a part of a tribe, though, honestly, like I love that, and in terms of like my own culture, we do have very tribal like aspects to us and how we live in a professional environment. It's very hard to feel that, especially if you're somebody who's very hard on yourself, which a lot of medical students are. If you're very hard for yourself, it's not so easy to just allow yourself to open up to even your seniors who know a lot more than you do, not only in the specialty that they're dealing with, but also know a lot more in terms of reactions to things than you do. Whether that is, seeing something that's uncomfortable in a hospital environment, and and being able to like take time to really digest that reaction. Your seniors are there, and again, I'm bringing back that whole like mentorship aspect because I love that so much. But they are around and they are available. They okay when they're in the middle of something, they're not, but they are available after hours. They are around, and they, it may be as silly as them offering you some lovely yum and honey. Real thing that happened to me. It was a moment where I got to open up with
Aw,
with a mentor, right? So
that's nice.
be aware of that and allow yourself to accept it, and you will find that yes, you are a part of a collective tribe. Already the fact that you are in medicine, you are under the umbrella of other medical professionals. We know what's up. So it's not like we will shun or judge if you were to come up to us and say something and look towards us for advice or support. On top of that, as a physician, you are part of another team. We know what you're dealing with. We've been there, shared experiences. Like, come home, man. You know what I mean? Like, like it's okay.
Yeah.
And then on top of that, to further it even more, to be an international medical graduate, international physician, yeah, like we're here. And I guess that's kind of like also the whole basis of the foundation of IMG is just come home. Like, we know what's up. Like,
That's that
it's okay.
home, right? And that's
Yeah.
the thing too. Like, it's not even just the environment, it's the people. And it could be one person that makes you feel at home in that workplace. Like I think that's what we have to remember, and that not to lose sight of how powerful things like paranoia and the fear of failing and letting down your tribe, because paranoia is not just something for somebody who's mentally unstable. Paranoia is a common human trait to be aware that maybe we're at risk of being kicked out of the tribe,
Mm.
right? It's being hyper aware is really what paranoia is. It's hyper awareness. Now, if it's assigned to delusions and hallucinations, different. But we're
Yeah.
talking about, like, yeah. And there were times, absolute times, where I swore a certain partner of mine that I'd worked with for a shift hated me. And then talking to another partner of mine, they're like, oh, so and so said they really loved working with you. And I'm like, what? I thought they wanted to strangle me. They're like, nah, they're quitting smoking that week. That I'm like, oh, geez. Okay. So it turns out there are other factors, but the about me part and the I need to survive, that hyper arousal burns. And
Mhm.
that 4 years in, I was tired of it. And I wasn't aware enough through those first 4 years of being a first responder of how that was more inside of me than my environment making me unsafe. That most of the people I worked with loved working with me. That I did great on. I never really had a call that went horribly wrong that wasn't just gonna go bad because the person was that sick.
Mhm.
Not to say I'm an amazing paramedic, but it was like I put so much on the fact that I was gonna fail, and it never really happened. That when I took the step back and I went back to school for addictions and mental health, and I was breathing finally. I wasn't, jumping out there into an ambulance all the time or stretching my brain, right? Like, your studies can do the same thing, right? Studying for an exam. So I took the step back and I realized, oh my God, Jake, you're super paranoid. Half those situations you projected,
Mm.
because trauma is strong, because it has to be, because we wouldn't be here as human beings if trauma was weak and didn't care about us. And that vagus nerve that many of you are well aware of is the biggest, thickest nerve in our body. You want to try to tell it what to do? All you can do is breathe, right? That's all you can actually do, or take a medication. Yeah. So there's the cool part about that. Once you learn what your response is, that's why I brought up the distress and dysfunction. Learn what that is for all of you. We're all different. Because when you're aware of it and you learn it and you make a relationship with it, that's where things get better. Journal about how you feel, you know, all these things, discuss it, be aware, express yourself. And that way you'll make peace with that wherever you feel it in your body. I feel it right dead center. When I feel threatened, it's right here and it takes my breath away and everything. We all have our different symptoms for it. When you learn it, you can be aware, take the step back and get help. How many people listening to this already see a mental health professional? I have a counselor I see. I just started seeing a psychiatrist, although I always thought that would be like, oh, I would never need it. We're human. It's like me saying I'll never need a mortician. It's like, well, one day. So, or a cremator, whatever one comes from, I decide. But the idea is, yeah, I think you get the gist of what I'm getting at
Yeah,
before I get into a ramble.
definitely, definitely to get help, and that it's not therapy is not a dirty word, guys. And it is something that's tough to allow yourself to do, and you may have different reasons why. For me, it was the time commitment to it that I thought was just so overwhelming. And just to kind of confide in everyone, this year was the first, and it's been tough with the pandemic, with our own timeline stuff. But this year was the first time that I actually did seek therapy, and it really put a lot of things into perspective. That time to just talk to someone. And again, it's like, oh, but you talk to your friends. Yeah, your friends love you, they accept you, but sometimes talking to someone who's on the outside of all your personal emotional investments of things can kind of also give perspective of how to look at certain things and how to even plan for that potential chaos that may come up, or that's a worry for you, whether that is, again, on an academic perspective, on tasks within your career perspective, or even in terms of like relationships that you have with other people as well. All, like, so many things can stress us out, so many things can be there. But really, definitely, as Jake said, looking at when you're at the point of distress and dysfunction, or when you're on with either side of that, and really coming up with your plan, your safety plan, which may include also with the accountability or taking the steps towards accountability within your network, your tribe, your team, is important. And I emphasize this, to take those steps of accountability with your colleagues who work with you, whether you are currently in school, or you're in internship, or you're starting a new residency program. Have a buddy.
Yep.
Like, and they may not be in the same place as you, but have a buddy who checks in, who can be that person.
See, that's that point. It's the relationship you form, right? You need somebody that you have a growing relationship with that way. And that's why it's good to also have a mental health professional that you form a relationship with. I sincerely believe that should be seen as a family doctor. Everybody should be assigned a case manager. Like, I am one now, and I'm like, oh my god, I needed someone who did this role for me like a year ago. Like, just someone to show up once in a while and check in. That's all case managers really do. They're just checking in. They're not intervening really, unless we see something that needs to be like really pertinent to intervene on. We're really just observing, reporting, building relationship. How can we support? And we need a friend that does that. Now, the good part of the friend, they may not have, they may be able to be more fun and fluid with that with you. But what a counselor or a psychiatrist, psychologist, professional will do, boundaries.
Mm.
And professionally have a bit of a plan that they actually have like you said, the outside perspective, where it's not the emotional triggering of your friend, who's hurt in front of you. This is your friend and they're suffering and you want to just fix it. Well, mental health professionals are well aware that you don't fix people. You have to allow people to fix themselves, and through empowering them, right? So having both is great. Have to have that. And if you don't like the one you're with, get another one. It's
Definitely.
possible that they're not right for you. And I think a really good mental health professional, and it's not bad, might say, look, I don't feel that I'm the most appropriate. I have a colleague though, but they won't do that because oftentimes that could be triggering. So they want to help you best they can. But if you don't feel it, just saying to them, look, I thank you for helping and all, but I just don't know if this is really working out. I just may want to try someone else. They shouldn't care about that. That's not the ego or priority of that stuff. And you know what? Start with your family doctor of where to go. That way you're not going to fall into like private stuff that you can't afford. Start with your family doctor. I found out a program called Scope through the University Health Network, and they're a specialized program for first responders with post-traumatic stress. I was like, oh, I didn't know that existed. And I've been one with that for years and I've never known. My doctor, Jake, you ever hear of Scope? I'm like, what? Yeah, the mouthwash. Yeah, I use that once in a while. No, dude. Like, it's a first responder mental health thing. And they'll got your bag, a caseworker, they got a psychiatrist. I'm like, ah! So, and if I wasn't ready, I would have said no, but because of what we've said. And my first time reaching out, I was about, I think I was 22-ish and I went to a counselor. I should have when I was 19, but I wasn't aware.
Yeah, being
So
ready,
yeah,
being able to accept help, is definitely a big factor in it. I also want to put one point out there,
yeah,
with respect to what we were saying about having, you know, um, a mental health professional who is right for us. You guys got to also recognize and realize that even the people who you love in your life may not have the best responses to your stressors. Um, and there are certain things that people around us who we love, whether it's a parent or a friend or even a partner, where they're just not apt to handle certain emotional situations. And here's the thing: don't put the pressure on everyone around you to be that perfect rebound for you for the things that you're dealing with. they may not be the right person to talk to. It's only it's one of those negative things that we allow us to do. You know from experience. Again, you've lived with yourself your whole life. Everyone else does not know everything that you've dealt with. So sometimes people may not be sensitive enough to what you're actually dealing with. They may not know what to respond because maybe they haven't dealt with it either personally, or that they haven't dealt with it when they or have already been in a similar situation. So don't take even sometimes their responses to heart. Get someone else. Get someone else who you know is more appropriate in terms of your intimate relationships, like your friends or whatever.
Yeah.
Your best friend may be better at talking to you about certain things or talking you down from certain things than your boyfriend or girlfriend or partner, however they identify. And it may be something that we think, oh no, but they're my everything and they should be able to. You can't say that.
You're asking them to be emotionally connected to you and disconnected at the same time, because it's impossible. You're right. And that's why we need the several to pull from. That idea that trauma informed, you have to be trauma informed about yourself and others. And what that means is that we don't know the limitations of everyone's stress responses. I don't know everyone's triggers. Your own parents, I love how you brought this up. My own parents and I, we've made a plan about whenever I'm in distress. My sisters are different with their stuff, but we all typically do the same stuff. My mom cannot sit with suffering. Well, she's a mother too, though. So deep neurologically, and every bit of her genetics is saying, I got to protect my children from suffering. And she went through a really difficult childhood where her parents weren't there for her as much as she was there for us. So there's projection there and all these things. My mom's not a mental health professional. She's not gonna be aware of all that. So when I'm sitting there going, oh, this day's just terrible and I don't know what to do. And she's like, oh, but you'll be fine. And we're here for you. It's like, I don't need to hear that right now. Like, it's true. But my dad, he's the one. He'll sit there, what's going on today, buddy? And he'll hold space. There's holding space, and then there is like fixing, right?
Mm.
And like there is a bit of a gray area in between, and we need to be aware of it. But holding space, when someone's absolutely in distress and they feel overwhelmed, you cannot get in there by trying to fix it and silver lining and all that. We have to be empathetic and compassionate. And that's one thing. My dad never didn't feel upset watching me that way. He felt like, oh God, this is terrible. I want you to feel better. But he just knew, like, I just got to sit here calm and show him he'll be okay. But what I do go to my mom for is that, mom, like, I just need love right now and a hug and support, because she's, oh yeah, I can do that. She knows she can fix that. Right. And like, she's so supportive. So I need both.
Yeah.
But there are times that my mom and I have went through rough patches because I've expected her to do what my dad does. And we
Yeah.
project. And then, and that's one of those things, right? So with our friends, with our family members, our parents, and our spouses, this is something I wanted to touch on. Relationships. The reason why healthcare workers, first responders, people in high stress professions tend to have high divorce rates and evidence and issues with relationships that are long term is sometimes we force that therapy role onto our spouse. And you all kind of touched on that. Like when I expect you to be the perfect response. It's like, well, no, that's what your therapist is for, to be the
Yeah.
professionally direct response to help you. When I come home to my partner, a lot of what we do is we just are honest. Like I'll say to her sometimes, look, I'm just really messed up today. I just need some space. And it's like, great. That's awesome. Well, that's good. Then good. I'm not going to go, now, can you do some CBT to me now, or help me with my distorted thinking, or can you do psychotherapy? Like, no, she's not trained. She's got her own job. She's got stuff to do. She's not expecting this. So of course, it's not going to go perfect. And then I'm going to resent her for it. And then I'm going to put that on her. Like she's not a good spouse to me or partner. No, it's what you said. We're putting the expectations because, oh, well, I don't need a therapist. Well, stop using everyone around you as
Yeah.
one.
Yeah. Yeah, no, it's definitely tough. And I think again, a lot of it comes back down to those experiences, knowing that yeah, this is not the best route, taking the time to really learn yourself, allow yourself to go through those struggles and failures so you can reflect on them, and giving yourself time to reflect.
Yeah.
And really being able to sit with yourself and think about how to better manage things around you. And again, with the openness to not give yourself that pressure to manage it by yourself.
Can we talk about why now? Because this is something I almost didn't think, I almost left my brain to talk about today. It's such an important part of all this. Yeah, why it's important to sit with yourself and what's going on and why it's so hard to. I will tell people here right now, and I'll admit this, the most pain that I've been through, I've broken bones, has been sitting alone with my trauma and anxiety and my nervous system buzzing and my alarm system's going off and just sitting with it and not trying to fix it and bat it away. Ouch, that hurts. You know why? You know how much that hurts? People will go to fentanyl to run from that pain. People will do many things. People will cheat on their spouse they've been with forever that they love because that pain, because some people sex takes that away. And that was a poor coping mechanism they learned and didn't get to address. Lots of different things come from this. So the more that you can learn, and that does take a therapist sometimes. I needed it. I needed intensive therapy to be able to sit with myself. One thing I'll admit to, and I think this is great, and we probably will talk about substance use near the end anyways, is like one thing I found before it was legal was cannabis as a paramedic student. Now, it was one of those things like teenagers drink before they're of age. We all are aware of these coping mechanisms. We all learn it's a coming of age. You know, everyone's going to see a joint passed around at a party in high school. And hey, maybe you avoided it, but it was around college time. And my roommates were awesome. We were having great times. And my one roommate just introduced me to it. And at first I just kind of once in a while would try. It wasn't a big deal. Then my roommates, they left. My program went on 3 months longer than theirs. So I was alone in North Bay, Ontario, a small little cold rural town. Not much to do there, but my only good friend smoked a ton of weed. So like we'd hang out and like we at first didn't really matter to me, but then like I started to feel that loneliness. I started to feel, and then the pressure of the career I was entering and like the exams I'm writing right now. And like, oh my God, I'm gonna have to get through placement, and like, which is my matching basically, and then get a job and I'm gonna take care of people. All that stress is real to all of us. But finally, when I was left alone, I didn't have my 4 roommates. That's a lot, right? To distract me and support me. And that's when I was sitting alone. And then the cannabis became like, well, that feeling's great. And it's way better than feeling like this, like all the time. But the problem was, I did ask my parents, can I see a counselor, do you think? And a lot, well, Jake, you know, it's your age, you know, you're going through a phase and it's anxiety. That's what they were taught. And that's why a lot of the older generation die of heart attacks and cancer and stuff. Potentially there's a lot in there. But one thing I found was that instantly when I started to use it, it became more of a crutch right away. I didn't know much about it. There wasn't as much research about it like 10 years ago, but I knew it helped. And I knew that when I woke up the next day, I didn't feel as bad as drinking. But the issue was I was getting it illegally and it was on the street and you didn't know what was in it, like many people. And the problem was there were times I'd have it and I'd feel good, and other times I'd feel worse. And wasn't consistent. And then my sleep started to rely on it because that's what I used to fall asleep. And then like times where I'd normally just go to the gym an extra time. Oh, well, you know, smoking a joint gets the same similar feeling. It's like, I started to feel weaker. Then I just what you said, the experience of delivering the baby, graduating and getting hired in Nova Scotia as a paramedic finally. Oh my God, I did it. Oh my God. No, I never thought I'd do this. I was able to stop. You know, I went out there. I was distracted. I was getting meaning, you know, and I quit for like months, didn't touch it. And then I got introduced to it medically, like really from a doctor, because I started to struggle with post-traumatic stress, like after. And I went to a trauma center and the doctor's like, well, Jake, you've used cannabis before. The medications you've tried, you don't like in them. The side effects are bad. Would you try cannabis again? I was like, well, I don't know. I'm a paramedic. He's like, well, let me tell you something. And he explained to me how a lot of first responders are starting to kind of use it when it's helpful to them. And it's not something I would say it's for everybody. And you definitely shouldn't use it unless you know why you're using it or you're well aware of the effects, right? But what I did find out was that because this time I sit down with a doctor and I got shown the research and I was able to read my own research, I did learn how to use it properly after that. And I got it from the regular medical sources that were giving me the strains that worked for my symptoms. So lower THC, higher CBD, a lot less psychoactivity, and they gave me a regimen They gave me a dosing regimen. They told me about like, oh, here's the effects you can expect and all that. And then things got better because I was no longer coping with it. It was just something that I used when I needed to for certain symptoms. And when I wasn't, the doctor was there to hold me accountable. And my friends, who knew that I used cannabis, I'd say, look, if you ever notice I'm using this more than normal, just let me know and I'll talk to you about it. And this doctor would meet with me every couple of months and say, hey, Jake, how much are you using? Oh, good. You're ordering the same amount I've always seen you order. Keep it up, buddy. Let me know if things change, because it doesn't mean smoke more weed. It means, wait, what are you not doing? Remember, physical, mental, social, emotional, legal, financially.
Mm.
And there. So it's one of those things I looked at, that when people explore substances as a crutch, you're going to have that pendulum swinging erratically. You're going to fall into a bit more of an issue. But if you're aware of what you're doing and you're doing things that are healthy, I also did a lot of things that weren't cannabis. Cannabis was a very distant tool compared to going to the gym all the time, going to therapy, talking to my friends, studying, doing engaging things that moved me forward. It then became just, oh, something I can enjoy, something that helps me get a good sleep when I need it. And I was then in control. So that's just the example I use. I don't mean for cannabis to be like the thing we all need to think of. It's just what was my situation.
No, definitely. One of the things though, like the sleep is something that we all need to recharge with. We're not batteries. We can't just plug in and plug out. Sleep is actually one of the biggest complaints that people have when they start crutching on substances or things. And so I think like even just like kind of noting that, and also knowing how vulnerable like the student community can be, and again like all that stress and expectation that we put on ourselves, really like if you're having issues with sleep, I think that's a really great time to go in and start that help seeking behavior before you
Yeah.
start getting into self-medicating behavior. And again, it's like trying to manage yourself and trying to be your own hero. It's okay to let someone weigh in.
Well, yeah, there's a lot of nurses that have problems with Benadryl and Gravol
Mm,
because, oh, it's over the counter, right?
yeah.
And there's this thought of, oh, I can't abuse something that's over the counter, or misuse, I should say. I don't like the word abuse, but misuse.
Mhm.
Um, Absolutely. And I think sleep, we have to remember, is a sign, right? Or in a sense, if you're not sleeping, it's not just, oh, I'm not sleeping. It's what's making you not sleep.
Yeah. And
Is it a physical thing, mental,
it's
whatever?
broken down on so many different things. When and what, like, are you waking up? Are you able to go back to sleep? So many different things. Sleep is so important. And I think that's also one of the underrated things. And we say it all the time, if I could not sleep, I'd rather. But we need to.
Well, we want to have 24 hours in the day, right? But we really
Yeah.
don't get to use all those hours. If you do, and here's the problem too, is people do then find things like, oh, great. Oh, well, maybe I'll go to my doctor. And because I'm well informed, I'll talk to them, in a way that they might prescribe me some Adderall or something like that. A lot of journalists as well, a lot of really high functioning people who have go, go, go jobs will turn to certain substances, not always because of a medical condition, but under the guise of one. And sometimes there's lots of factors to that. And other people, they need it, absolutely need it. But there's context. And there are some people who've gone, well, my friend gave me this Dexedrine and I tried it. And wow, I was great for like 16 hours. And like that's their first couple of days on it, right? But then checking with them if they're doing that every day for a few weeks. Ugh.
And and we joke around about this in the student community, and I'm sure like you've heard it too about like getting Adderall for to study for important exams and stuff, and
But
it's
not
just
to
like,
say, by the way, I just want to put in there as a harm reduction worker, I wouldn't say, oh, you did, that's bad. Hey, look, we all have the rights as human beings, if well informed and avoiding harms, to maybe, make decisions to improve quality of life, but the relationship, right?
mhm.
With it.
Definitely. But like, like so we joke around about that because where does it come from? It comes from being burdened by the expectation of having to perform in a certain amount of time. Um and that's going back to the things we were talking about before, these unrealistic expectations and not being able or having room to be able to turn around and say, hey, this amount of time is not appropriate for this assessment. And we don't really do that. And I think it's kind of like taboo even in like student culture and in all universities or colleges to turn around and say, hey, I appreciate what you're teaching me. This is an inappropriate timeline. Like, like has a student ever said that? Not really many ever.
We're not allowed though. That's the problem too, right? Like we need
Or
the
we think
culture to
we're not.
change. Or we
Or
don't think
we
we
think we're not.
thank you. Cause
When I
well,
went,
yeah.
I'll tell you a story, and it has nothing to do with medicine at all. But when I was in grade, like, it was like grade 3 or something. Okay, we had this thing called a tuck shop
I know
where
that. Yeah.
for lunch, for lunch they came around with the cart and you could, put a loonie or a toonie or something and buy it. And there was something, I don't remember what it was, some sort of bag or whatever. That was, I don't know, $5 or something. And I turned around and said, "That's too expensive. Forget about it. I don't want it." Well, because of the volunteers were moms, that mom turned around to me and said, "Okay, how much do you think it is supposed to be?" I said, "Well, for what you have in there, I think it's like, just a little more than this, but it's not as much as this. So I would pay, like, let's say $3 for it." She said, "Okay, give me $3 and that's fine." So I got for $3. She ended up inviting me to help out with, like, the tuck shop signs or whatever, and going through pricing and stuff. I mean, maybe it was like a little, like business initiative or something on my end at that time. Like, so this kid who was just like, "No, I'm criticizing your price points for children." Like,
You felt safe to do it though. Something inside of
I
you.
definitely felt ballsy to do it.
But you have to sometimes have that, and I will use the word like assertiveness, right? Like assertiveness isn't always being sure. It's just like, hey, I know what I need or I know what I want. I'm gonna try it out in a sense, right? So that's kind of cool. I think they saw that and they're like, hey, this is a nice haggler here. They're gonna become really good at pawn shops one day.
Or
Or
they know their community, they know what people are going through, and that's why, like roles such as class rep or student council, they're very important, and I really enjoyed, whenever I was involved with those. But it's so important to bring those complaints, to assert what you need as an individual from the student body, so that they can represent you and they can say to those who are making decisions, "Hey, if you're not considering it for our year, at least consider it for the next. At least give us some sort of compensation with regards to it, because this is what the unanimous, like, feeling is. Not necessarily unanimous, but this is, if one can say something, there are so many that aren't saying anything."
yeah, and there's that I like the idea, like the fear of not saying anything and how so many people don't. That's why we continue this cycling and why it's so scary. Like part of the reason why I didn't even try to go further into medicine is like, oh my God, I'm gonna fail. It's like, I just know it. But the idea, it's not true though, right? We all have capability and capacity and we gotta learn. I'm not supposed to know to be a doctor tomorrow. It's you gotta learn. So, and work on yourself. So one thing that's kind of cool is the more of us that become that voice that goes, okay, I don't put myself out here. Oh boy, I feel kind of naked, but like, and no one else is doing it, but I want to say something here. The problem is there have been times to have made examples of. And I remember specifically my teacher saying to me in paramedic school, when you get out there with your preceptor, oh, they know so much about the road that, like, all you know is theory, right? You gotta understand they know so much more. And like if they do something one way, don't question it, just do it their way. That's literally this. And many of you who are listening to this can already agree, like how dangerous that, yeah, it's dangerous to say that. And because and there were times, I remember a specific time that I was afraid to speak out and it caused an error that was bad. We are coming out of an elevator for a person who was having trouble breathing. They looked up unwell. We can see from the doorway, like from the elevator to the doorway, they're not looking good. So we went to lower the stretcher. And one thing as paramedics we're supposed to do is we look each other in the eyes, go 1, 2, 3, lift, and we bring it down. Why? Because the person on the trigger, you have to coordinate so it doesn't drop exactly a teeter totter. And that is what happens, by the way. If you take the weight off and pull that trigger and the other person's not carrying it, it's going to collapse.
Yeah.
But what I started to do as a student was count every time. And all of my mentors who worked with my preceptor and stuff, these are different partners, would all laugh at me. Jake, come on, man. Just look me in the eyes. I know when you're going to lift. Except one morning, this one, I came out of the elevator. We folded the stretcher to fit in the elevator. I went to grab the trigger. I looked at my preceptor. She looked at me dead in the eyes, the way we always do. I pulled the trigger. It fell to the ground. Pulled her shoulder. She had an old injury. It tore it again. Instant pain, but we got through it. She's like, it's okay. Like, and I noticed what happened. She wasn't finished pulling up the back of the stretcher. Her eye contact was almost coincidental. Well, everyone just told me the last month and a half, stop counting. You're being silly and you're making this take too long. that happened. Yeah, and she did get injured. The injury was bad. She continued the shift because you know how sometimes those injuries it's later, right? She went off. I got pulled in front of supervisors, and I was grilled. And you know what they kept focusing on? Why didn't you count?
The irony.
And I did say to them, I said, and I was honest. I said I did count, and people kept saying to me it was ridiculous. I
Yeah.
messed up, but I messed up because it's the environment too. And another time was when I was struggling with that next preceptor who was really hard on me. I did take a moment to pull him aside one day and say, look, I really want to do well. And I feel like your approach is really stressing me out and it's hard for me to focus.
Good for you.
Hey, that was scary, but hey, I'll tell you something though. It was from burnout. I
Yeah.
wish I did it out of recognizing it earlier, but I waited till I was done and I didn't give a shit what he was going to say to me. I said, I'm tired. I want to do well. I love this job. And you're making me not even want to come in the next day. And he stopped like so shocked, like, whoa. He's like, Jake, I figured there's something you're struggling with. I couldn't put my finger on it. He's like, I even talked to my wife about it at home. I'm like, wow, he cares. He cares, right? Because he's not like, oh, fuck this. He's actually trying to figure it out. He's telling me, right?
Yeah.
And he's like, have you been checked out for things like depression or ADD or something like that before? Because like, I want to help you. He's like, how about this, Jake? Because I know you really care. You're having this talk with me. Every call, let's split it up. You're not going to run every call. I'm going to let you be my partner on every other call to give you a break. Right. And then on the calls, you feel confident. Step up, buddy.
And just with regards to like that example, our colleagues, some of them who are in residency right now, sometimes you feel like you can't really say something to your seniors, to your supervising physicians, because of, again, those expectations and the perceived notion that you cannot talk to them about certain things. Again, at the end of the day, you're in a team environment, you are needed, and especially when you're a resident, you are taking care of certain tasks. A lot of things are falling on you. What's great though now, and at least in North America, is that the mental health aspect within a program is prioritized. So making sure that residents actually feel like they are having that good work-life balance, regardless of whatever specialty it is prioritized. So I would encourage everyone who's watching this, if you are a resident or someone who's starting residency soon, and if you're having any sort of like triggers that you're worried about, vocalize it, speak to your supervisors, let them know what your well-being is in that program. They will listen because there's two things that we care about. It's patient safety and the well-being of our colleagues. And even though people are tough, even though people may grill you or come down on you, your well-being and ability to be able to take care of patient safety is the most important. So really communicate it. And yeah, and say something if you need something.
This is why I like that. The say something if you need something too is like a really good way to kind of like summarize it, because the note I'm writing here, it's the three things that based on that having to say something, the mentors look for and that the tribe looks for. So that back to the paranoia and anxieties that we were talking about earlier and how we are saying how strong that is and that it can really throw you for a loop and trick you. Delusions are not just for people who have schizophrenia or are in psychosis. Delusions are just a poor, like not perceiving things correctly, right? On a level, I know there's the clinical, I get it, but like, hey, you most of the time that you think no one wants you there and that you're a failure and you should just quit, most of the time that's a delusion. People want the following three things. They want you to have self-care, just to be aware of what you need and that you find your flow with it, whatever that means, or you're trying to. Honesty is the other one. Even if it's like, I don't know what the hell I'm doing right now. That's a great thing to say sometimes.
And
but
safe thing to say.
If, and the problem is some mentors are triggered by that because they remember when they were that and they don't like that feeling. Or like, oh, well, I can trust you. Well, look, I'd rather have my partner say to me, Jake, I don't know what the heck I'm doing, because I trust that person more. Right? The person who's willing to say, look, I need your help. I'm being honest here. And then the other part of that is willingness to learn. That's it. Because the person who's like, I don't know what the hell I'm doing and screw it. Well, they got a lot of things they have to deal with.
Yeah.
And that person may not be ready for the field, but the person who's like, I'm not ready for this situation, but I want to be for the next one. That's it. My best mentor, or I should, you know what? I say this all the time. I'll just keep saying it. But he is my best mentor I've had in the field. He was 7 feet tall. You know, he was imposing. He was stoic, but he was warm and friendly. How? Because his confidence and understanding. And I went to the most serious calls I ever been to just by chance. He was the supervisor on duty those days and came and backed me up on them just by chance. And what he said to me after each one of them, he's like, Jake, the reason why I think you're going to do well in this, you know, it's not that you're going to know everything. You're not. It's that you're pretty honest about asking those questions when you're not sure and you want to learn. And that's what all these other medics are going to look for in you. And that never sunk in back then. I wasn't ready to hear that. I was like, oh, but I still got to be better. It's like, yeah, he knows. It's like, you'll get there. He saw that. And I remember the day I left, and I told him, I was like, hey, Scott, I just want to let you know, like I resigned and moved back to Ontario. I'm going to go back to school for addictions and mental health. He's like, Jake, just want to let you know, really liked working with you. And I cried that day. I went, I cried. I was like, what? It
Huge.
was that, right? And all of us have that. That's the thing that we need to learn to love ourselves with. We all have the ability to take care of ourselves, nourish ourselves, nurture ourselves, be honest, and want to grow. And that's what a tribe looks for.
Mm,
That's all. So if you're ever going into work or school or any situation like, oh, I don't feel like I'm fitting in here, just remember that people just want me to be okay. They want me to be honest and want to learn, and then we'll all grow.
definitely. Solid words to finish up on, actually. So, yeah, is there anything else that you want to tell our colleagues before we close off for today?
Really just a reminder that you have varying levels of care of biopsychosocial plus. Identify those in your areas in your life. Identify which of those are risk factors for you that you maybe want to improve on or fill in the gaps in which you have really good protective strengths in. Keep track of that. Your physical, mental, social, emotional, financial, legal well being is important, all of them. And if you're ever struggling to meet those needs or to keep up with those responsibilities, it's not that you're failing, it's that your needs are not being met. There's Maslow's hierarchy of needs we all draw to, and the brain is programmed that way. I know it's a theory, it's humanistic theory, I know the textbook, but our brain's programmed that way. If you're feeling unsafe, your nervous system will not allow your brain to focus on progression until the threat's been dealt with. That's why you're going to be so stuck. And that's why some people, I remember my worst of my PTSD was staring at grocery store aisles, knowing what I had on my list. And I can't pick it up because it's all chaos. Once those needs are met in our body, you're sleeping. Remember, glad we brought that up. You're eating, you're drinking water. How many of you drink enough water? Supplement your coffee, please. I'm still learning that.
Oh.
I've seen this come up a couple too many times, I'm sure. But the idea is when you know those things biologically, psychologically, then you have the resources to be aware of your thought processes, the pathways that are most active to you. And then you can be aware of which ones are good and bad and which ones you want to improve on. And then social. Then you can then look towards social engagement and being a part of the team because you are secure with your mind and body. And then your self-esteem will grow from that you're getting meaning, that you're feeling accepted, and you're seeing your life move forward. And then once that's there, we can transcend and hit that self-actualization and the ability to really be there for other people. And hey, this continuum, it changes minute to minute, day to day, and we're human.
Definitely. Thanks a lot, Jake, for all that. I'm sure a lot of our colleagues, in even after this video is posted up, will definitely benefit from the resources within it.
Good.
Guys, on the foundation's webpage under our course discounts, Jake has been really great with assisting everyone in terms of having mental health first aid, which is something that's not actually a part of our first aid um, curriculum when we do it for even for the level of a healthcare professional. But if that's something that you're looking to develop, you can head on over there and basically send over an inquiry and yeah, develop your skills, especially if it's something that you're interested in.
Yeah. No, I really hope that I can be a support in any way to help empower anyone who's taking part in this. I think it's a really awesome foundation, and I think that we just need to be there together. And I'm happy to be there as well as support, and hopefully can contribute more as we go.
Awesome. Thank you. All right, guys, good luck, and we'll see you soon.
Take care, everybody.